To ensure you're getting the proper care for your physical therapy sessions, you should be going through all 3 phases of rehab. Regardless of your injury, these 3 phases ensure you get back to doing what you love as quickly as possible with results that last. My name is Dr. Dan Luxco, and I'm the founder and owner of Instacare Physical Therapy. I'm going to guide you through these 3 phases of rehab today so you know exactly what to look for in your treatment sessions for maximal results. The first phase of rehab is the pain mitigation phase. This phase varies in length depending on how much pain you're in and for how long. When someone's in a lot of pain, say after a low back strain, the pain may cause their low back to tighten up worse, causing that person to avoid moving and become less active. This reduction in activity only adds fuel to the fire, increasing stiffness and pain. By focusing on pain reduction so you can move more freely and frequently, it will not only have you enjoying your day better, but allowing your body to loosen up and stop adding secondary issues to the main culprit. After a back strain, other muscles and joints nearby may add to the original problem if you're not moving. So that way, preventing these secondary sites from becoming problems as well will speed up your recovery process. This may take 1 or several sessions to calm down, depending on your severity and how long it's been bothering you. The second phase of rehab is focused on solving the core root of the problem. If the cause of your low back pain is due to a sciatic nerve getting pinched, then the focus will be on reducing that irritation to the nerve and getting rid of the dysfunction that caused it in the first place. By ensuring the core root of the issue is taken care of, it helps to make sure that the individual feels 100%. This phase can overlap with the first phase as well and can vary in duration depending on the severity and complexity of the issue. The third and final stage of rehab is the strength and resiliency phase. By now you should be feeling much better overall, focusing on improving the strength of your muscles, tendons, ligaments, and bones. We know that the stronger you are, the more your body can safely take. In this phase, the exercises should match the demands for your body. An example would be lifting a 30-pound weight from the floor if you have a 30-pound toddler at home. We want to make sure that what you're doing in the clinic matches what you need to do outside the clinic. If you're an athlete, you may be practicing sprints or heavier weights to ensure that you can do everything physically outside the clinic that you can do in the clinic. It is not enough to just use TheraBands and tubing to build your strength and resiliency, especially if you have more active goals in mind. But by now, you should be out of pain and looking to build up your armor to reduce the risk of a future injury. The stronger your bones, tendons, and muscles are, the more they can take before an injury or issue occurs. Research supports lifting weights to prevent the risk of injury in the future, and it helps prevent or reduce osteoporosis. So remember, there are 3 phases of rehab. First is pain mitigation. Second is fix the core root of the issue. And third is the strength and resiliency phase. These phases may overlap and vary in duration depending on many factors, but all 3 phases are essential in making a full and quick recovery that lasts.